Welcome to Care Talk Shorts, where we take one important healthcare issue and cover it in depth. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
Well, John, our topic today is social determinants of health.
A terrible term.
What is that, and why are we talking about it?
Well, it is the term du jour of healthcare. Social determinants of health. Sounds kind of boring. It actually is pretty exciting. What it refers to is all of the different things that can influence your health that are tied to your environment, your family situation, your housing situation. What's exciting is we're expanding the definition of what healthcare should be to include all the things that can directly influence your health. If you can't eat, if you're food insecure, you're 3 to 5 times as likely to spend time in the emergency room. If you've got an appointment with a doctor and you don't have transportation, you're much less likely, or easy transportation, or transportation you can afford, you're much less likely to get to the doctor. And if you're housing insecure, it's going to be really hard to focus on anything other than a roof over your head. So what the social determinants of health really refers to is all of those things can affect a patient's life. So it's sort of a whole patient view. So when we think about the social determinants of health, it's all of those things that are sort of non-traditional but critical influences that can really determine whether a sick or vulnerable person gets the care they need.
John, the thing is, it sounds like you're talking about, socialism. You're talking about kind of government taking responsibility for people.
Oh, come on.
Isn't it better to have people sort of taking care of themselves and being accountable instead of just sort of saying, well, I'll just let the government come and pick me up and give me a ride to the doctor?
First of all, the government isn't doing it. It could be the private sector. It could be a community-based organization. We already are paying a lot of large bills in healthcare that are higher than on an age-sex adjusted basis than any of the industrialized countries. Now, if you look at the other industrialized countries and you look at what they spend on social investments, transportation, food, housing, social support, behavioral, outside of healthcare, and add it up to their healthcare budget, they actually spend about as much as we do on healthcare plus social. The difference is in the US, 70 cents out of every dollar is spent on the healthcare system, whereas in the European system and in Japan, it's about 60 cents out of every fully loaded dollar is spent on social purposes. So they get a much better deal for healthcare because they're making a much bigger investment on those social investments. What that means, by the way, and pencils out to, is a much lower cost per member per year, per citizen per year, and with better outcomes. There's maybe one statistic in the top 20 statistics of health in the industrialized countries that is tracked and for which we have data where the US is winning. And every other one, we're a laggard. We spend a lot more and get less. And perhaps one of the biggest reasons for that is a long-term generational underinvestment in the kinds of things that prevent folks from getting care and probably have them cycling through a healthcare system that costs too much and does too little. So social determinants of health is a phrase that only an economist could love, but you got to think about it as whole patient and whole health. If we look at what's working in the other industrialized countries and we try to mirror it because they're getting better outcomes, you've got to be looking at the social determinants of health.
So, John, I'm a little confused about why we're talking about it now. Like, why is it just sort of coming up in consciousness? Is somebody doing anything about it now, or are we just sort of happy talk?
It's a really good question. And I think there's really 2 reasons. One is that there are trends where things people get more excited or less excited. We should have been more focused on the opioid crisis a number of years ago. Now we're focused on it and it's late. I think with the social determinants of health, there's 2 things that are happening. One, we've got access to a lot more data than we've ever had, and we can normalize it across different industrialized countries. And we know the facts are there that investments in social supports, either in comparing it across countries or looking at subsets of populations where patients have had access to these kinds of supports, like in the PACE programs, where they've had dramatically better results than in fee-for-service Medicare or Medicaid without these social support systems. So the data is there. The second thing is we're sort of running out of expensive things to do to try to bend the health cost curve. Now we're starting to look at inexpensive things we can do that could potentially dramatically lower costs and improve outcomes. So better data and fewer options. And I think it's all to the good.
So, John, what I see is some things out there like you'll have a hospital, and they've got an empty lot next to the hospital where they're planning to build a big cancer center, and they'll put a farmer's market out there, and they'll call in the press and they'll say, look what we're doing for social determinants. And then you also have something that's going on the government side. Look at what Trump has done.
But let's stop. Hold right there. You've got a great hospital system, Geisinger, in central Pennsylvania. It's a model in a lot of ways for healthcare. One of the things they've done is they've created a food pharmacy, Pharmacy,
where
they are actually prescribing healthy food for complex diabetics, and they've dramatically reduced hemoglobin A1C levels. They're moving the markers on people who've got diabetes more than would otherwise be moved by drugs themselves. People are healthier. And by the way, if you've got a diabetic family that learns how to shop correctly and has access to food when they didn't have it before, the entire family is healthy. So it's probably not just helping that diabetic, but also everyone in the family. So cut the cynicism aside. I will say that if you look at what, on balance, hospitals are doing, they're still very focused on the industrialized production of healthcare.
That's what they're good at.
But this theme, we're in early stages of this, looking at healthcare in a different way from a whole patient view. And there are hospitals like Geisinger and others that are making the kinds of investments that are game changers for their communities, and particularly for the vulnerable people in their communities. Hospitals aren't there yet, but park your cynicism at the door. So this is a time for optimism.
The valet, I'll take it. But John, what's the role? You mentioned some private sector initiatives, but when we were talking about sort of changing the whole social environment, there's certainly a role for government and private sector. What roles are being played? What role should be played by government and the private sector?
You're focusing too much on the themes of socialism, big hospitals. Let's look
Government's not necessarily socialism.
Let's look at what's actually going on right now in managed care. You've got United Health Plan is committing to build or engage with creating thousands of units of housing to take care of homeless people.
They're also sponsoring the Apple Watches.
This is far. The Apple Watch. The Apple Watch is a promotional thing.
Fine.
If you look at other health plans, they're expanding access to food for food insecure folks. I think you're seeing managed care being much more creative on the private side in Medicare and Medicaid, and you also have the federal government expanding what could be available to actually be covered under the Medicare Advantage benefit to provide or invest in these individuals and in communities in resources that will allow people to access the healthcare system, live a healthier life, and it'll be lower cost for the managed care company as well as the government. I actually think this is a really exciting time. Now it's gonna happen a lot through healthcare, and there is a legitimate question in your glib, silly approach, which is,
give me another adjective.
What's the line between government and the private sector? But the reality is, the government is already paying for complex diabetics. It's already paying for the obesity epidemic in Medicare and Medicaid. 51 cents out of every healthcare dollar is paid by the taxpayer. So really all we're doing is changing where we might make some of those investments to lower the cost trend, which is a tax on every American.
John, I'm okay with the government playing a role, but I see some things going on that are helping the social determinants and some that are undermining it. So they're talking about actually having Medicaid help to pay for housing, which makes sense. If you don't have a roof over your head, you're unlikely to be well and be healthy. At the same time, you see that Trump administration saying, let's take away benefits like food stamps, and not just the Trump administration, the Republican Congress. Let's take away some of these social supports.
Total agreement.
And for immigrants,
it would be. There's definitely a breakdown between what Alex Azar, the Secretary, and HHS and CMS, all these acronymic agencies that are focused on health, and the politics of Capitol Hill. They haven't caught up with one another. We can't be cutting access to food while also defending and trying to expand the need for food for hungry people. 1 out of every 5 households in America is food insecure, and that without a question affects healthcare costs. But I think that what you're seeing, because we've got more data, is more logic and more arguments that are data-driven, saying that we have to make these investments in vulnerable populations to protect the vulnerable so they can get access to healthcare. I think we're just in the early stages of a golden age of dealing with the whole patient need with whole patient resources. And the most important ones are food, access to stable housing, and transportation. And I think all of those are going to be available through the federal government based on where the Secretary and CMS are leaning right now.
Well, John, you've persuaded me that social determinants of health, or whatever you want to call them, is a worthy topic. And also, I want to end on an optimistic note and say this may be an area of opportunity for cooperation between the administration and the new Democratic Congress. So that's it for this edition of Care Talk Shorts. We've been talking about social determinants of health. I'm David Williams from Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for watching.